Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vondo Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Kim Rich. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vondo Reynoso.
Thank you, Gina. May I have my first slide, please? I'd like to begin this briefing with data trends in our county. The Public Health Department, we are closely monitoring vaccination data to ensure that vaccinations happening in our county are equitable. So while 48% of the county is Hispanic, only 20% of those vaccinated are Hispanic. So that's concerning. There are other similar concerning trends among communities of color. Santa Barbara County Public Health Department is committed to working to ensure all residents have access to COVID-19 vaccine. We have recently partnered with various community groups to offer vaccine to farm workers and other vulnerable groups. We have also intentionally allocated vaccines to our under-resourced communities and the providers nearby. Next. This graph describes our vaccination rate. We have received 135,400 doses. Of that, we have administered 70,157 first doses. We have given 38,139 second doses. For the Johnson & Johnson vaccine, that's a single dose vaccine, we have administered 3,160. Altogether, we have administered 82.4% of the doses of the allocation that we have received. So this really tells the story that week after week, we continue to see a very high percentage of vaccines being administered by our partners and by our public health department in our county. The remaining doses, so you see 82.4%. So I want to note that the remaining doses are slated for clinics happening in the next few days. Next. To remind everyone, Phase 1B continues to be eligible. And so those in 1B include the 65 plus years of age, food and agricultural sector, workers in education and childcare, as well as workers in emergency services. And as well, eligible are individuals 16 to 64 who have deemed to be at very highest risk of morbidity and mortality from COVID-19 as a direct result of severe health conditions. So medical records and doctor's notes are not necessary for you to get a vaccine appointment. We will just ask for a self-attestation. Next. With regards to vaccine distribution, appointments available at public health vaccination sites on Monday for clinics on March 23rd, March 24th, and March 25th for the agricultural and food service workers, as well as emergency services. These appointments will be available at 9 on Monday. Vaccinations for transitional kindergarten through 12th and childcare are continuing to be coordinated with the Santa Barbara County Office of Education. Vaccinations for higher education will continue to be coordinated with our school liaison. The hospitals, pharmacies, and primary care partners will continue to serve persons 16 to 64 years old with severe health conditions, as well as the 65 plus community members. We do anticipate a significant increase in vaccine allocation next week, and more details will be shared next week. Next. As you may have heard, we are finally in the red tier. So we are enjoying the opening of various businesses and places in our county, and our eyes are now on the orange tier. But we really need to focus and adhere to our precautions, our health precautions, so that we can continue to see a decrease in case rate and testing positivity. That's the only way that we are going to get to the orange tier. Next. So to get there, we all need to do our share. Please continue wearing your mask. Please continue to social distance and get tested. And with the last bit, please continue to limit your gathering, especially around spring break and especially around spring holidays. If you gather, keep it small and keep it outside and keep it short. Thank you. And with that, I'd like to transition to Dr. Ansorg, our County Health Officer.
Thank you, Director Dorenoso. Good afternoon, everyone. We are really glad that our high school sports have been allowed to occur again. Given the high contact between team members and their opponents, water polo and football in particular are sports that cannot be played while wearing a mask, and they can lead to widespread transmission of the coronavirus. In order to be able to let these high contact sports resume, a stringent mitigation plan has to be maintained. This includes mandatory testing once a week of all team members and their coaches. We have seen many positive cases in athletes of multiple schools over the last week. This is concerning to us, and we believe that isolating the ones who tested positive and quarantining the team is crucial in preventing further spread of the virus. We understand that this might be disappointing and frustrating to the affected individuals, their teams, and their families. However, the safety of the young athletes, their coaches, and families has to come first. Given the very high positivity rate in our local sports teams, we find it necessary to continue with weekly testing for these high contact sports for the time being. We will issue a health officer order accordingly. Please understand that we still have substantial community transmission of SARS-CoV-2 in our county. We cannot let our guard down. Any potential for crowding at sports fields, including sideline observers, have to be kept at a minimum. Otherwise, these high contact sports cannot be allowed. For Santa Barbara County, we decided to adhere to the youth sports guidance that allows for immediate household members to be at the sidelines observing training and competition. We will, however, not insist on the one parent only strategy as recommended by CDPH in a recent question and answers addition to the youth sports guidelines. As a county, we are at a crucial point in our local COVID response. On one hand, we are well on our way with more and more vaccination in conjunction with social distancing and mask wearing to continually reduce community transmission, hospitalizations, and deaths from COVID. On the other hand, we could easily risk another surge in cases if we stopped with masking and distancing too early. This past week, Many more venues with indoor patronage have opened up again, and we want this good trend to continue. The Public Health Department, together with our healthcare partners, are doing whatever we can to get the vaccine to everybody who wants it as quickly as possible. In the meantime, please continue to stay vigilant and choose safe options for your entertainment and other activities. Thank you for your cooperation. I would like to go back to Dr. Do Reynoso for some additional remarks.
Thank you, Dr. Ansor. I'd like to take this opportunity to honor the lives lost in the recent Atlanta shooting spree. It is critical for us to note that of the 8 people who lost their lives, 6 were Asian women. 4 were killed at the spa in Cherokee County, about 30 miles northwest of Atlanta. They were identified by authorities as Xiao Ji Tang, 49, Dao Yu Feng, age 44, Delana Yan, age 33, Paul Andre Michaels, age 54. 4 people were also killed at the spas in Atlanta. They were identified today as Soon C. Park, age 74, Hyun Grant, age 51, Soon Cha Kim, age 69, Young A. Yu, age 63. As public health director and as an Asian American woman, I'm devastated by the senseless loss of lives. This killing spree and other attacks on members of the Asian American Pacific Islander community threatened the health and safety of all members of our community. Collectively, we must recognize that racism, individual, institutional, and systemic, is truly a public health crisis. Next. So I invite you to take action. Speak up when you witness racism and bias in action or speech. Listen and create safe space for the community member who's being targeted. Engage in discussions on equity in race, gender, sexual preference, and all aspects of life. Support the collection of data and other robust measures of accountability in order to track and assess progress on achieving racial equity. Prioritize investment in promoting racial and economic equity to address social determinants of health. Support proclamation that racism is a public health crisis. I'd like to thank Supervisor Greg Hart, who will be co-sponsoring this proclamation at an upcoming Board of Supervisor meeting. The Public Health Department will continue to work in partnership with all of you to develop strategies to address and dismantle racism and bias that's fueling these attacks and other hate crimes so that we can build a more just, equitable, and healthy county for all. Thank you.
Thank you, Dr. Do Reynoso. And with that, we will now, open it up to questions from the media. First up is Blake DeVine with KUIT.
Hey guys, first question, Ansor kind of answered it in his own terms, but I wanted to get Vaughn, if you could just explain the decision behind not enforcing the state's 1 adult limit for fans in the stands.
Blake, great question. We reviewed the state's guidance, and unfortunately, it didn't make sense to us either. And so we reached out to the state. We reached out to our colleagues, as well as reviewed all the different guidances. And as Dr. Ansor shared, we are guided by other guidances, such as live performances, such as outdoors activity. and concluded that at this point in time, with social distancing, with the with the observers being in a single household, safeguarding the social distance, that it is a low risk activity.
Makes sense to me. My next question could go to Dr. Onsorg. You mentioned that there's a high positivity rate for local sports teams. Can that be attributed to the fact that they're getting tested more frequently than they would have been? Or is it because they're in contact with all their other athletes and coaches that they weren't before? And how concerning could this be with us trying to get in the orange tier with our numbers, trying to stay a certain way with more people testing positive in the athletics?
Yeah, Blake, I think you answered your own question quite correctly. It is because we are testing more, and understand that especially in the young age group, a lot of positive cases are asymptomatic or have minimal symptoms, so they feel perfectly fit and healthy, and that is not unheard of. And so that is also why it spreads so fast and easily among the younger generation, who is just more socializing, and especially when you play high contact sports like water polo and football, obviously with training and games going on, you will have a lot of contact, close contact, while you're breathing heavily with exerting yourself. And I think that's the reason. On the other hand, I do not believe that this is such a huge amount of positive cases that it would actually stop us from getting our case rates down. I don't think it's to that extent. It's just looking at, that in just 1 week of testing, we had so many cases in various different schools. It's not just one area, that we just felt strongly that it would be safer for everybody if we continued with the testing for the time being.
And then last question for me, obviously we reopened in the red tier this week. St. Patrick's Day was a day later. A lot of people went out. And then this weekend, March Madness, going to be a good amount of people at the sports bars watching UCSB in particular. What would be your message to people that plan on watching the games and going out with us trying to, again, reach the next tier?
Yeah, sports bars are absolutely unsafe. You're shoulder to shoulder, having a beer, shouting for your preferred team and so forth. That's absolutely a scenario for super spreading events. So it is also not part of our tier guidance that bars are open. Bars are only open if they serve food and people have to be seated, so to avoid crowding. So yes, all these activities are very dangerous in order because they can simply cause super spreading events. And I would encourage everybody to really be very careful about your behaviors during this time. It's tempting, I understand that, but it's really important to keep your distance and avoid mingling with unmasked people.
Awesome. Thank you so much.
Thank you, Blake. And next up, we're going to Tom Bolton with Noozhawk.
Good afternoon. My first question, Governor Newsom said today that he expects the vaccination tier system to be gone in 5.5 weeks by early May. And I'm wondering how much confidence you have in that projection.
I can take, yeah, I'm happy.
Either one of you,
Yeah. I think we both feel that we are reaching a pivoting point. We are reaching a level where quite a few people have had the opportunity to sign up for a vaccine appointment. And if we are looking ahead with more vaccine coming our way in the next several weeks, May 1st, I would concur. I feel optimistic about that date to open up for anybody who wants it.
Okay, and a related question is, do you anticipate that there will be another group that becomes eligible before then, before it's simply opened up to everyone?
That is possible. Once we experience what we call a saturation, that we have a lot of no-shows or people canceling their appointments because they were able to get the vaccine sooner already somewhere else at a pharmacy or something. Once we reach that, we will have a very close look at our situation, and we might open it up. And the next tier that we could potentially open it up to is anybody over age 50.
Okay, that was my follow-up question, is who would be likely in that tier? So it would likely be age related?
It would likely be age related, yes.
Okay. An unrelated question. In the last few days, the case numbers reported seem to have plateaued or even risen somewhat. And I'm wondering if that's a trend that you're concerned about, or is that just an aberration of how they're being reported?
I'm a little bit concerned about the plateauing. I would like for the numbers to go down more continuously. And but it's not to a degree that I'm alarmed. But I think it is a stark reminder of, that's why we're giving this message again and again. We still have widespread or significant transmission of the disease in the community. So please still keep a distance, wear your mask, and all these things that are proven to be effective.
Okay. My last question is for Dr. Del Reynoso. You were talking about the inequity of the vaccination, and particularly the Hispanic community, Latino community. Do you think that is due to a lack of knowledge in that community about the vaccination programs? Do you think it's due to a hesitance to be vaccinated for some reason? Or do you think it's something else?
I think it's all of the above. I think that a lot of it, some of the barriers, has to do with not being aware of where they can get a vaccine, not being aware that it is available and they are eligible, and not knowing enough about the vaccine. So for that reason, we are partnering with various community partners, trusted leaders, to amp up our messaging around the accessibility, around more information about the vaccine, just to address those barriers.
And do you feel you're making progress in that effort, or how significant is that progress?
I think that in addition to all of our efforts, I think partnering with employers and partnering with media will net a sharper uptake of vaccines in our Latinx community.
All right. Thank you very much.
Thank you so much, Tom. And next up, we're going to go to Laura Place with Santa Maria Times, who will be followed by the Daily Nexus and Santa Maria Sun.
Hi, everyone. Thank you. My first question, it's also about vaccination disparity, but between North and South County, as well as Mid County, which I know I've asked about before, but it looks like that trend's continuing and even growing stronger. In South County, there's about double the vaccination rate as there is in North County. And it's far, far lower in Mid County areas of like Lompoc. So, can you speak a bit to some reasonings why that may be? Is it just a lower level of providers and lower level of vaccines in North County and Mid County?
I think that is a combination. When we allocate our vaccines, it is with very careful attention to make sure that it is available in all of the regions in North County as well as Mid County. I think that a lot of that has to do with the willingness of community members. Perhaps they are not ready to take the vaccine. I know that we shore up our outreach efforts. We have ramped up our 211 efforts to ensure that we can offer assistance in registering community members. I think that all said, we will be, I mentioned earlier that we anticipate a significant infusion of vaccines into our county starting in 2 weeks. So we will be planning wide access starting in the mid-county in the next few weeks. And we will be blasting our outreach efforts and information about those vaccine opportunities as early as next week.
Okay, can you clarify that a little bit when you said perhaps they're not ready to take the vaccine? Are you talking about like vaccine hesitancy?
That is
Um,
correct.
okay, so are you suggesting that there's the same, level of outreach in all areas of the county though, and that there's just less willingness in like North and Mid County?
Yes, I would say that our efforts are primarily in North County and Mid County. Our outreach efforts.
Yeah, I would like to add something. There's a lot of disinformation on social media. There's a lot of, uh, clearly wrong information. The vaccines available here are very safe and are very effective. And I encourage everybody to ask for more information. Make sure you get your information from trusted sources and not just from social media or conspiracy theorists, but from trusted sources. We've seen incredible safety in our county and across the nation of these vaccines. So I encourage everybody to get it as soon as you can get it.
Okay, and going off of that, just on the topic of North County, within that effort to vaccinate, or to distribute 2 million vaccines throughout the state to, those 400 zip codes that came in lowest, for health equity. It seems like there were around four, I think, or maybe three in Santa Barbara County and a couple in Lompoc and Santa Maria. So, as far as pushing out vaccines to those specific zip codes, was that effort mostly handled by the state, or did county public health also help with that effort? And if so, what did they do to move that along?
So nothing has changed. And you know why? Because the public health department, from the get go, we have known that the burden of disease is in North County and accessibility, perhaps more barriers in North County. So from the get go, as soon as we received the vaccines, we were very intentional in building the partnership in the healthcare system as well as in the community to ensure that vaccine allocation and distribution and receipt are equitable. And so we are continuing that. I want to say that Santa Barbara County was ahead of the state in paying attention to health equity areas and the need to provide equitable access to vaccines in those communities.
Okay, so but just to the first part of my question, specifically those efforts in those 400 zip codes, which includes a few in our county, are those efforts kind of just handed off to the county to
That
kind
is
of include? Okay.
that is correct. So it is the county's obligation, it through the allocation of vaccines, to allocate 40% to those healthy places index first quartile as deemed by the state.
And was there any increase, in like additional providers to kind of ramp up that effort in those areas? Um, maybe additional pharmacies, or was it kind of the same level of pharmacies in the hospital, just getting more, kind of having more of a responsibility to just distribute more?
So we use our existing vaccine approved by the state vaccine providers and increasing allocations to them as we receive from the state.
Thank you for clarifying that. One last question. As far as the variants, cases of variants that popped up in our county that were reported earlier this week, have there been any others detected by the CDC through contact tracing efforts, or is it still just those two in our county that have been identified?
Yes, I'm happy to speak to that. You are right. Two carriers of the UK variant were identified. They were identified because of an ongoing monitoring program that is in place run by the CDC nationally. And they look for PCR positive samples that follow a certain pattern that makes them more likely to be a UK variant. And then those samples get automatically transferred to a sequencing lab. And that's how this happened. So those were not particularly ill people or people who were getting reinfected. Those were just routine tests that were done because their PCR test pattern looked a little bit suspicious for this. And sure enough, they had this virus. They were ill 4 weeks ago because it takes a long time to get this whole genome sequencing done. So we reached out and confirmed that they're doing well and they are way through their isolation period, and there's no further threat with regard to public health.
Okay, so no further cases have been identified then so far?
Not so far, exactly.
Okay, thanks so much for taking all those questions.
Thank you, Laura. And next, we're going to Atmika Iyer with the Daily Nexus.
Hi. So I know that during the winter surge that the United States was generally just a few weeks behind Europe with their surge of cases. Do you think that's applicable currently as well, seeing that Europe is seeing another rise in their cases?
Well, that is our concern, and that's why I said earlier in my remarks that we are at a critical point here where we have to not let our guard down. We have to continue with mask wearing and social distancing, and we have to get as many people vaccinated as soon as possible. That is the big difference between Europe and us here. We have much more vaccine. We are so much further ahead of getting people vaccinated compared to Europe. In addition, in Europe, this UK B.1.1.7 variant of the virus is rampant. It's the main type, and it spreads faster. Fortunately, we don't have this situation locally. Our California version of the mutated virus apparently is as quick or almost as quick as this UK variant, and therefore the UK variant has not been able to outrun this California variant. So it's a blessing in disguise maybe that we had our own variant develop here locally. So the future will show, but I think our advantage locally is the high vaccination rate that we are achieving and improving from week to week. Makes all the difference.
Thank you, Dr. Ansorg. My next question is, April 3rd is Deltopia weekend, and as the unsanctioned rampant event that it is, it will likely invite a lot of people from outside the county, as it usually does, as well as a lot of people within the county. And last night, the Isla Vista Community Services District Alternative Plan was deemed possible to increase transmission and was voted down. Considering all those factors, does the county have a plan in place to address the incoming event? Will there be more public officers there? Will there be more law enforcement? What's the general plan?
The general plan is partnership between the county, between the city, and between UCSB and the Isla Vista community. We are all aware that Deltopia could be the super spreader if what you shared. Typically in the past, it's been a huge congregation of people. That is indeed the super spreader event that we want to avoid. So in partnership with all the groups that I've just mentioned, we have been planning to mitigate such a large gathering. So that does involve messaging, that does involve discouraging visitors, that does involve putting into place enforcement activities as well.
Thank you. My next question is, I was reading a really beautiful piece about how grandparents are actually being more convinced to get the vaccine by their grandkids than anyone else. And I was wondering how you would advise approaching that conversation with loved ones about vaccine hesitancy and how to convince your closest people that the vaccine is indeed safe and
You know, if I have had the same similar conversations in my family, and I'd like to keep it simple. Getting a vaccine is the kindest, is the most charitable way to show your immediate family and those around you, your family, that you care for them.
Got it. Thank you. My last question is, I know that the CDC updated their guidelines today to say that only 3 feet is required between desks in schools. I was wondering how that affected school approval plans with schools that have already opened or schools that are planning to open.
Well, to my knowledge, the CDC recommends that for elementary schools, not for all schools. We are in the red tier, and elementary schools have been open or allowed to open now for the past 3 weeks, and secondary schools are allowed to open. Yes, we do have COVID safety plans in place. Every school has it and posted on their website, and it does include social distancing. So they're doing everything they can, and I think we are fortunate enough that we have most schools being able to extend the social distancing to more than 3 feet. But we would not stop a school from opening in elementary school if they could only accomplish a 3-foot distance.
Thank you so much.
Thank you so much, Atmika. And actually, that concludes the questions tonight. It looks like Santa Maria's Sun probably had their questions answered. And so with that, thank you, everyone. That concludes today's press conference. As a note, the Board of Supervisors will not be in session next Tuesday, and the next press conference is Friday, March 26th at 4:30 p.m. In between, we will continue to issue updates and information to the media via social media channels, through our partners here in the county, and to our e-news subscribers. As a reminder, each Thursday in the 11 a.m. KEYT news broadcast, News Channel's Joe Batista will interview one of our county public health officials, and that will be bringing you live updates and information, again, 11 a.m. on Thursdays. For more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, and more, please go to publichealthsbc.org. You can also call 211, select option 4. And before we close tonight, as soon as I'm done speaking, stay tuned. We are going to air a special message from the county. And with that, have a safe, healthy, and happy weekend.